People often ask us, what's the best treatment for acne? So I've been treating acne for the past 30 years. I'm Dr. Joe Murphy from the Skin Clinic in Drogheda, County Louth in Ireland. And we often get asked that question, what's the best treatment for acne? So the first thing I look at is to make sure that it is definitely acne, because there are other things that can look like acne. So we have to think of the differential diagnosis. So things like folliculitis, things like rosacea and perioral dermatitis. And then, like all medical conditions, we take a history and examine the patient. So we ask the patient how long it's been happening for, and particularly, are there any things that might have triggered it? Because there are a lot of supplements out there that people are taking nowadays which are triggering and aggravating their acne. So these could be food supplements, sometimes it's even medications as well. And a lot of people are on these supplements and they don't realize that that's the trigger and the driver of their acne. And sometimes we also have people taking medication, particularly hormonal medication, which is also triggering acne. So we have to look at these things and exclude them from the picture. We then look at the patient and determine which type of acne they have. Is it comedonal? Are those comedones open or are they closed? Is the acne papulopustular? Is the acne cystic or nodulocystic? Or there's other forms of acne as well, acne necrotica and acne excoriae. So the treatment, people ask about the treatment, but the treatment actually depends on excluding triggers, and also it depends on the type of acne that the person has. So if the person has comedonal acne, open comedones, we generally treat those with topical preparations like topical retinoids, topical azelaic acid, topical benzoyl peroxide. We also use peels. We also use laser treatments. So salicylic acid peels, for example, can be very good for comedonal acne. However, if the acne has a lot of closed comedones, this is treated in a totally different way, and we have to open up those comedones, and we have techniques where we open up those comedones and we treat them very efficiently like that, because a lot of people with closed comedonal acne, the regular medications just don't work and the regular topicals don't work, so they need another method of treating their closed comedonal acne. Then if it's papulopustular, mild papulopustular, moderate papulopustular, and if the topicals aren't sufficient in the treatment, we have to add in oral medications. So that could include oral anti-inflammatory type antibiotics. Now we don't like to use those for too long because we're trying to reduce the amount of antibiotics used in medicine, so especially in the treatment of acne. So if we could use them maybe up, say, to 3 or 4 months, but after that we don't like to use prolonged courses of antibiotics because that's not good for the person and it's not good for medicine in general. So if we found that the person has a more severe acne or an acne that has potential scarring, or it hasn't responded to topicals and it hasn't responded to adjuncts like peels, and hasn't responded to anti-inflammatory type antibiotics, we then look at systemic retinoids. So the most commonly used systemic retinoid, of course, is Accutane. So people have a phobia of this type of treatment, and in my opinion, this is unwarranted, because if you use the systemic retinoid in a proper fashion, like if you use the Accutane in a proper fashion and you use it very carefully, you don't get the side effects that have been traditionally associated with these systemic retinoids. So that's very important. And I think a lot of damage is actually being done by people being afraid to use the systemic retinoid. They're delaying the treatment and they're then ending up with scarring, which is actually very difficult to treat. And they're also ending up with psychological issues with regard to having severe facial acne, because I had acne myself as a teenager and I know what it's like. You don't want to leave the house and you feel very self-conscious when you have acne. So I do like, if I see a person like that, I do like to introduce the low dose Accutane regime, which we use very effectively and with very few side effects. There's a big phobia about the so-called maybe psychiatric side effects of the use of systemic retinoids. But in reality, if we use it in a low dose and we increase very gradually, we don't actually see much of these low mood or anxiety or suicidal ideation or suicides. It's just something that's extremely rare if it's used properly. Of course, if you went and put a person on high dose systemic retinoid straight away, that could cause issues. So the key is to use it to start low and go slow, just to move up gradually. So the other thing we might mention is the use of other adjuncts in combination with acne medication. So say if somebody is on a systemic retinoid, you can use peels along with that. You can use topicals along with that. You can use measures to open up the closed comedones. You can use laser. We use the sciton BBL laser in association with systemic retinoid, and this speeds up the process and helps the resolution of the acne. Another thing that it do, which might be a little bit controversial, is while the person's on the systemic retinoid, I actually do use, again, low dose fractional ablative laser. So we find that if we do low dose and low depth, low energy settings, we then can treat scarring very efficiently, even while the patient is on low dose Accutane. And this can make a big difference and prevent the scarring in the longer term. Side effects with regard to a systemic retinoid. People worry a lot about these side effects, but generally what we see is dry lips. So most of our patients get dry lips. So if they get dry lips, well, we can treat the dry lips. That's not an issue. So we don't worry about that too much. Again, as I said, the psychological side effects are actually extremely rare, and it's not something we encounter very often. In fact, what we usually find is the opposite, in that the person might, with the severe acne, might come in feeling very sad, depressed, anxious, and when they actually see the systemic retinoid kicking in and improving their acne, they actually feel happier. So we see more patients who feel happier on the systemic retinoid. They actually regret that they didn't start it earlier. And sometimes it's parents, and parents are afraid to put the teenager on the systemic retinoid, and the result then can be that it can actually cause scarring. So another thing that we do see sometimes is a purge. What people call a purge, it's an initial flare of the acne when the systemic retinoid is used. And what I tend to use sometimes, we will use an antihistamine in conjunction with the Accutane. Now that seems to lessen the risk of that initial purge. And if it's very severe, we then sometimes have to use a systemic steroid for a short period of time. But we only rarely use that. We don't have to use that too often. Sometimes with cysts, we have to inject a little bit of intralesional steroid into the acne cyst if they're very severe, particularly at the beginning. And overall, we find that we always get a good result with the acne patient. It can take a bit of time. Patience is required with acne, but we always get there in the end. There's no patient that we've seen that we don't clear their acne, because, as I say, for me, that's a very important subject, because I ended up with acne untreated for many years myself as a teenager, and it really did affect my confidence.